everybody. I'm doing my first Facebook Live. I've got a couple people here in my office who are going to be listening to my talk about acid reflux. So I'm going to be looking at them and looking at you, and I'm going to just do the best I can with Facebook Live for the first time. So, welcome everybody to what I think is really the most important talk and one of the most important subjects that we can talk about, and that's acid reflux. And the reason I feel that acid reflux is the most important topic is because our bodies need nutrition, and if we don't have nutrition, then we're malnourished. And the way we get nutrition is by breaking down what we eat so that our bodies can get fed. So many people have acid reflux, and for those of you who want to know how that is spelled and said, a lot of people say it in different ways. Acid refers to our stomach and the environment that we need in the stomach in order to digest our food, to break it down. And reflux has to do with something that occurs when that acid comes up and causes pain in our bodies. So what we're going to be talking about is why that happens and a couple of good things that people can just do at home. And if they need to have more guidance, and if the home remedies don't work, how we can resolve the acid reflux. So I'm going to draw a picture here of the stomach and how digestion occurs. And those of you who are here in the office know a little bit about this already because we've discussed it. And those of you who are out in Facebook Live land probably know a little bit about it, and some of you might not know anything. So I'm going to just start with it. Some of you might just be suffering with acid reflux and not know why. So this is what happens. You eat your food, and the food goes down into the stomach, and there's a little valve here that allows this food to go into the stomach. There's a diaphragm that we've heard about. That's the thing that gets spasmed when we have hiccups. That's our diaphragm. Our lungs live up in here. Our lungs live up in there, and our heart and lots of organs and so on. And so our food comes from our mouth down here, and this little valve opens and allows the food to go down into the stomach. When there's enough acid in the stomach, the food can then break down into tiny little bits, much smaller than that, and then another valve opens and it goes down into the small intestine, which is where we start absorbing our food, our nutrients, so that our organs and glands and our cells can use what started out as an apple or a piece of steak or a piece of bread or whatever it was that we ate. So all of those things can in some cases be very good foods for a lot of people, and in some cases, of course, people can't eat some of those foods, which is another topic for discussion. And so what we want to talk about is how come this acid in here, this acidic food and the acidic environment, tends to go back up into the esophagus, and then we end up with all sorts of symptoms. The first one you may notice and might take you to your medical doctor or to your chiropractor or your natural health improvement center in your area or your natural health care provider is pain. So a lot of people get pain when they eat, and the pain can be anywhere. It can be in the chest. We call it heartburn, because it feels like it's burning around your heart. The stomach tends to be closer up to the left side of the body, and so does the heart. So if there's acid coming up here and you feel like you've got pain in there, that feels like something that we call heartburn. It's actually not the heart, but many people do go to the hospital thinking that they have a heart attack. Well, they do all the tests and everything, and they end up saying, no, you don't have a heart attack. You may have acid reflux. So what ends up happening is that in the medical view, the solution is to decrease the acid in the stomach. Well, let's erase this picture so that we can go back a step. Acid is required for the food to digest. We need an acidic environment in our stomach in order to have food digest. So in order to have digestion occur, our stomach needs to be very acidic. The acid in the stomach is a really good and important thing. In fact, there are certain minerals, such as calcium and iron and minerals that we absolutely need to use to be healthy, to have strong bones and so on, to have strong blood, even to have strong skin and strong muscles. We need to have the amino acids from our proteins break down. All of that happens only in an acidic environment. So let's think this through. If we have acid reflux, okay, so we've got a valve that might be a little leaky or weak, and we have a stomach that doesn't have enough acid in it because, well, why wouldn't it have enough acid? We're getting a little older. Perhaps we lose acid in our stomach as we age. If you think about it, it could be that your friends who have acid reflux might be a little bit older. You might not know 20-year-olds who have acid reflux, but you might know plenty of 50, 60, 70-year-olds who have acid reflux. Things get a little weaker in the body. Our acid decreases. Our natural acid decreases in our body. The acid that we make decreases in our body. And so now we have food in our stomach and it just doesn't break down. So you go to your medical doctor and your medical doctor says, oh, I want you to, obviously your medical doctor wants you to get rid of your symptom because that's what you went there for. So your medical doctor is doing a good thing by helping you to get rid of your symptom. And your symptom is what? Pain. You could have pain in your stomach, you could have pain in your neck, you could have pain in your back, you could have pain in your head. All of these things can occur from heartburn or acid reflux. So what they do is they say, oh, it's acid reflux. The acid from all of this breaking down and just sitting there is what happens. It's just sitting there. And so that non-digested food becomes acidic. So the non-digested food becomes acidic, and that's what goes up, along with whatever acid you do have in your stomach, back up into the esophagus. So the one approach is to give you something that is called an antacid. So it's anti-acid. It causes your stomach to become less acidic, and sure, the pain might go away. The problem, though, is that you then do not break down this food because the stomach is no longer acidic enough. So it's kind of a loop-de-loop sort of thing, and the solution is actually to increase the acid in the stomach. That might sound a little bit scary to somebody who's having acid reflux. They're thinking, oh my gosh, I have too much acid in my stomach. It's coming up my esophagus. How could I dare to add more acid to my stomach? That sounds really scary, and I completely understand that. So if we think it through, we can think, oh yeah, I do understand why this food needs to break down and needs more acid, but gosh, isn't that going to be more painful for me? Well, it isn't going to be more painful for you unless you have an ulcer. And no, not too many people actually have an ulcer. That, again, is another topic that we can discuss another time. However, the test to do to see if the acid reflux can get better is to take a tablespoon of apple cider vinegar. The best one has the label that says "with the mother" on it. And you get just a small bottle to see, and this test will tell you if you have too little acid in your stomach or if you have an ulcer. If you take a little bit of apple cider vinegar with the mother, and in that, and then you get severe stomach pain, that means that's not the solution for you, and you probably have an ulcer. It's also a different kind of a pain. An ulcer pain is a very different kind of pain. It's a very sharp, localized, burning pain in the stomach. It's not the same thing as this generalized reflux that you're getting with acid reflux. So then, if that works, what you'll notice is you're feeling better. Other symptoms may go away. You may have gassiness. You may have belching. You may have bloating. You may have even skin problems. All sorts of things can occur. You may have weak muscles because your amino acids are not being broken down, so you don't have the amino acids that you need to make your muscles be strong. So all sorts of benefits can occur if you have the correct acidity in your stomach. So if you take a tablespoon of apple cider vinegar with each meal, and then you notice, I'm having a little less gassiness. I'm not belching as much or bloating as much. And in fact, when I go to the gym, I feel a little bit stronger. Eventually, redness of the face, rosacea, those sorts of things might go away. All kinds of things can occur. Even sleep can get better, and energy. And some people have foggy thinking. They don't have a good clarity of thought, or they're exhausted. Many of these sorts of things can be affected by too low of a stomach acid. And there's a fancy word for that. I'm going to fit it in here. It's called hypo, meaning low, hypochlorhydria. Hypochlorhydria. That's what low stomach acid is. So the home solution for this is to start adding some apple cider vinegar to your diet. So for those of you at home who want to just see if that'll help, that's my best suggestion for you. If for some reason you still are not completely solving the problem, a practitioner like me who works with nutrition response testing, who works with nutritional supplements that are actually made of whole foods, is the person to go see. I treat people with acid reflux probably almost more than anything else, other than maybe thyroid issues. So hormonal acid reflux digestive things are so important. And the problem with having ongoing use of the medications that the medical doctors are putting you on to decrease the stomach acid, whether it's the kind that's over the counter that just decreases it temporarily, or even worse, the ones that cause you to not make stomach acid anymore, those people are really in danger. So those drugs are not meant for long-term use, and I have so many patients come in who've been on them for years and years and years, and they're in danger. They're in danger of cancer. They're in danger of heart attacks. They're in danger of weak musculature. They're in danger of osteoporosis. There's so much that you need to have your nutrition for. And if you're malnourished because you don't have enough stomach acid, and therefore your stomach can't digest your food and have it go to your organs and your cells, then you're malnourished. So that's one piece of the acid reflux. There is another piece, and that is the structural bit. And so this valve here can get floppy and loose, and it can kind of meander up into the esophagus. And as a chiropractor, I know how to pull that down, and if we normalize the stomach acid and we pull that down and give the body less stress in this whole area, then the person can potentially get better and get off of the medications that are so dangerous long term. So I thank you a lot for watching my Facebook Live. If you have any questions, please do contact me. My phone number is 410-717-6610, and I'm here in Columbia, Maryland at the Natural Health Improvement Center of Columbia, Maryland. I'm happy to continue this conversation with anyone who'd like to contact me either by way of Facebook or by phone. And if you'd like to have a more detailed assessment of your own health situation, I'm very happy to do that with you as well. It's in 31 years, it's the best work that I have been trained in, nutrition response testing, and I would love to share it with more people. So thanks a lot for watching, and I'll see you on the next Facebook Live.